Right? So iPad, say you might not say fully agree with me, but for any presentation or anything is to be made on laptop is much easier. For iPad, it is good to present. For the presentation, iPad is wonderful. But if you have to make it now, तो it is the laptop. It is like physical book or digital book. वो physical book का जो मजा है, right? It is always there. But well, you cannot buy all the physical books. Right? So some of the digital books, they are totally fine. But physical is physical. Hmm. And and thank you so much for all those loving emails. Thank you, thank you, thank you. Regarding two major things. One, fast forward, maybe 25 years, right? We are in year 2050. Your kid would be in college, right? You'll be super hi-fi, one of the best doctors. This is approximate, right? You have got a kid, right? Maybe boy or girl, whatever. It really doesn't matter. And he or she, if tells that mom or dad, I want to become a doctor, maybe at that time the fees would be, guess, 2 crore, right? But you have got but 2 crore. Will you be telling कि नहीं नहीं बेटा तेरे लिए पैसे नहीं खर्ची? This is the answer to that you are worrying about your parents, right? It's a very good feeling. It's definitely a good feeling, but it really happens like that parents, they live for you. They live for you. So the best thing what you can do is that yes, they are spending this much money. So make it worth it. Learn, become such a good doctor that you pay, not only pay that thing back, because parents, they never expect कि नहीं तो मुझे ये पैसे वापस करने, but you reach to that level when they are proud of you. Bas. Regarding this part, if they are spending the money, this, yes, that's true. That's true. And that feeling is totally right. That feeling is totally right. It shows that you really care for them. But, well, तो क्या मतलब, if they don't, then तो जाके मजदूरी करोगे. No, you have got brains here. You can learn. You can become one of the best doctors. So, bus, set this thing as the aim of your life and work on it. Work on it. So many messages. Just a minute. Let me put it on. Rich. Those. My father was not having even that much because me along with my two sisters, right? So almost they couldn't get good marks. So quite a big burden was for their education. So I had to even do a job into an electronic shop. So after completion of it, and after completing clinics at 5:30, I used to take my cycle, 15-kilometer cycle, and then reach to that electronic store, right? Star Electronics, that was the thing. And I was the counter boy. I worked over there for 3 years. 3 years. So from 5:30, 5:45, right, to night 10 o'clock. So at 10 o'clock from there, I used to reach to my house at around 11 o'clock night. Then I used to have dinner and then go to sleep. और कुछ पढ़ाई करनी हो या ऐसा हो तो. So this was, it was bit problematic at that point of time. But well, it's God's grace. So I would advise that you go for the job, right? Because it is too much burden. Unless and until if there is no other option, then it's a different thing. But otherwise, focus very properly on your studies. I mean, Samriddhi, nothing much. We talked about Apple event, which is happening today, right? Then whether to go for laptop or iPad. So if it is your first choice, so my first choice is always the laptop, right? And then thank you so much for everyone's email. And this is what we talked about, whether you should be worrying about your parents. Definitely worry about the parents because they are spending so much money. But against that, instead of worrying, study well. Bas, in one word, I would say that study excellent. Regarding revision pattern, yes, seven emails they were on this revision pattern. And most of the emails they were from those students, those who have joined bit late. Sure. This is the pattern, very simple pattern. On the YouTube channel, you go to playlist, and in that playlist, there is one playlist which is general anatomy. It is important that you go through those lessons, right? You go through those lessons because concepts, they are important. Then what right now is going on, this is the upper limb. No, there is not much of the problem. Even if you continue with the upper limb, saath raho, that would be more than enough. Because we'll be following the same order. We have completed lesson 1, we have completed lesson 2. Today we'll be going for the lesson 3. It will be going into the same order. So even if anyone misses here or there, nothing much to worry about. We just go through those lessons. In case of any query, just send me a mail, right? Send me a mail, and that query, I'll take it in the live class about next in PG me to. ठीक है. We'll surely talk about these exams, but this will be on one extra day. So otherwise, we won't be able to give justice to the topic. So remain with us for the upper limb. General anatomy, try to finish it as early as possible. So yes, you have to really spend time. This is the email address. I've written it over here. Right? This is the email address. In case if you are not having that email address, here it is still mbbs@gmail.com. Send a mail to me. I'll send you two things. One is the Google Drive link, right? Our Google Drive link. This is a Google Drive link where all the PDFs are saved. So you'll be getting all the PDFs, and all the new PDFs will be landing over here only so that you can always remain in touch. It will be comprising of many other things also, like some important books, etc. That is again up to you. But I wish that don't stick only to medical. Even some extra reading should be there. Extra reading should be there, right? So this will help you all. Sorry, just a minute. You are making so much of noise. Just a minute. Yes. Right. So this is how you do it. And for the memory pattern, let's make it still simpler. This is the 0 day. 0 day means right now. So for example, today we'll be discussing the axilla. Before you go to sleep, right? Before you go to sleep, that is at night, before sleep. Go through the PDF at a very high pace. Now, say for example, in this case, there are 65 pages. So you should not take more than say 5 minutes. बस 5 minutes तो बहुत हो गया. In fact, you won't need even 5 minutes. Today, yes, we'll do the revision. I got your emails that can you show how to do revision? Definitely. Right. In case if I forget, just remind me. So this is and in the morning, that is after you wake up, right? After you wake up, do this thing again. And then every week, that is, say, for example, every Sunday, go through all the PDFs at high speed, right? Because Sunday is as such free. So do spend some time. Now, today, if you're taking 10 minutes for a PDF, next time when you revise, you'll need 5 minutes. After that, you might need just 2 minutes or 1 minute. And then it will become like, even if you're listening to songs, even if you're watching a movie, right, still the PDF is getting scrolled and your brain will keep on revising it. That is what really happens. Right? It comes into your nature. And this is, and trust me, this is true for everything, whether it is IT, whether it is finance. I mean, yesterday I was in one of the finance conference, and say, I mean, I never insult anyone, but what he was talking was so nonsense. So I couldn't stop myself. So he said कि दोस्त, it is बहुत easy है वहाँ audience में बैठे बैठे बोलना. I said, you want me to come on stage? Okay, give me the mic. I asked, he said that yes, you invest the entire money into our mutual fund. I said, this is wrong. It's a wrong strategy. Because if you invest everything, he said, see, GST is going down, Trump might soften up, this, that. I said, what really happens is that no one is God in this market. So if you invest lump sum and if the market crashes, you will cry. But if you know that, okay, say for example, defense sector is fantastic, right? IT sector, which was last time, it was down, today it is up, right? Simply because of Infosys. Infosys has gone for the buyback. Yesterday only I was discussing this on the stage. He said Infosys, I said Infosys is a company which is going for the buyback. What is buyback? Buyback is, Infosys is telling that currently the cost of its share is 1,545 per share. Infosys is telling कि I'll buy it at the cost of at the rate of 1,700. Give it back to me. I said that. He said, oh, definitely karna chahiye. I said you should never do that. You should never do that. This was our argument. I said, if I am holding a company and if I'm doing a very kachra business, absolutely फालतू business, so then what I'll say? अरे मेरे शेयर ले लो, मैं अपने शेयर भी बेच दूंगा, because I know my company is bogus, right? But if my company is good, if I'm confident that I'm coming up with something fantastic, right? My stock will go at the cost of 2,000 rupees. So then why should I really share my profit with everyone? I'll go to the market, के लाओ share वापस दे दो. 1545 से 150 रुपया ऊपर, give my share back, right? Because I know that just after a month, I'll be hitting such a project that market will boom and my stock will go up. So I said, this is a common logic. He said, no, आप तो डॉक्टर हो, मैं 20 साल से इस बिजनेस में हूँ, आपको नहीं पता मार्केट कैसा होता है. I said, okay, thank you. But there was some argument over there. He said, invest entire money into our mutual fund. I said, one should never do that. Because the principle is, as such, if you do the back testing is when you go for all the previous record, every time when the market falls, that is the point when you buy, right? Warren Buffett and the guru of Warren Buffett, right? He has said these words that when people are in panic, buy. Because when people are in panic, they will throw their stocks. Nahi, market gira. And when people are in euphoria, sell them. Because that euphoria comes down very fast. So this is the basic principle, the golden words of this Warren Buffett, that is called as the Buffettology. That he learned it from his guru. So, but that guy was like, he was not ready to listen. Even public was telling, कि sir, आप सुनो तो उनकी. But that guy is telling, no. A doctor cannot compete financial investor. I said, okay, thank you. वापस आ गए. But this is what.
Sir,
हाँ बोलो ना.
maybe they were delusional.
Anyway, please, I was telling that, see, I am talking simple thing, but he said नहीं. क्या हमारे कितने सारे क्लाइंट्स जो हैं, दे आर डॉक्टर्स, और डॉक्टर्स को कुछ नहीं आता, कहते दे आर जीरो इनटू फाइनेंस. ठीक है सर, एज यू से.
So, but basic knowledge, now never put all your eggs in one basket.
Exactly.
Exactly. So right. And that also, buy all the eggs for the entire year today only. And then keep on saving them. I said, no one is God in the market. If the market dips, right, your mutual fund is fantastic, right? But as such, it is conglomerate. I said, you have given a good word, but सादी भाषा में conglomerate का मतलब है खिचड़ी. Right? It is khichdi. You are buying IT, you are buying defense, you are buying finance, you are buying reality, you are buying FMCG. Everything you are buying. So he said, yes, if one goes up, another, if one goes down, another something is coming up. I said, true. But then this is like if something goes down and other comes up, so it is the average out. Your money is not increasing. Your money increases when there is a specific theme, then you have got some purpose in mind, right? And buy only those stocks. Don't go for those random things. But because no one opposed him for about an hour, so then he didn't like it. I said there is
So
one
maybe he knew if you speak that it will affect his things.
possible.
That's why he was not allowing you to speak, I guess.
No, पहले तो पता है उसने कहा कि अरे सर वो बहुत इजी है, हम ऑडियंस में पीछे बैठने. Means I got bit late over there. I reached about 5 minutes late. तो पीछे की सीट पे बैठा था. रिसेंट वो तो वहां पे बैठे बैठे बोलना बहुत इजी है. आप यहाँ क्या आप उनका अरे यार दैट इज माय प्लेजर आओ. चलो. सो टुडेस टॉपिक इज एक्सिला प्लस. Amazing topic, right? Because by the end of this thing, you'll feel like, yes, now gradually things are getting filled up. So whatever you have learned till this point, we'll be adding something extra to that. Oh, so many messages quickly. That is also my habit to read at least few books. Alchemist, superb book, superb book.
Sir, but I didn't get anything out of that book.
क्यों नहीं पढ़ा?
नहीं पढ़ा लेकिन ऐसा समझा नहीं कि
अच्छा,
तो
अरे तो
philosophical
मुझे बत
background.
5090 PE लिया था इन्फोसिस से नीचे 1487. अच्छा वेदांत, you are into this. Oh boss, by the way, if you are doing F&O, it is very dangerous. It is very dangerous. Unless you have got a proper grip, because when you do CEPE and futures, right, this is like a full-time job. Trust me, full-time job. मतलब कई बार क्या होता है, जैसे suppose निफ्टी का आपने कॉल ले लिया, right? You took the call of Nifty, say 25,000 call, right? Today only it will be expiring today. Today is the expiry, right? Now the expiry is on Tuesdays. And it goes up, तो you feel देखा मैंने कितना बढ़िया. But what was the foundation behind it? किसी ने बोला, did you study the chart? What was the pattern, right? So it is like, was it a cup and handle pattern? Unless and until you really know. Otherwise क्या bluff मारते हैं. अब bluff में तो क्या यार 50-50%, right? मैंने बोल दिया कि मार्केट अभी नीचे जाएगा, पता नहीं, right? I'm not watching it, but I'll say market नीचे जाएगा. If it goes down, तो I'll say देखा है बस मैंने बोला था ना कि मार्केट नीचे जाएगा. But for how many times, right? नहीं, never play this thing. Never play this thing. I used to do in CEP this all put and everything, but stopped it. The best is analyze it. You'll be surprised, right? I'm disclosing this. I purchased Borosil. In 36 rupees. Year 2019, when the market crashed. It crashed so badly, right? Borosil came on 30. End of 2000. In fact, I should write 2020, right? Market crashed. And so Borosil is making the glass. That is borosilicate glasses. The glasses which are used for the sniper guns and for the optics in the army, in the military. And if you go to the site of Hindustan Aeronautics Limited, so you'll find that most of the sniper rifles and everything, their glass, it is made up of them. Similarly, the glasses which are used into the space technology, they are also made by them. They are one of the finest makers of the glasses. Purchased it long term. Okay. Then what happened? Borosil's price started increasing. Its demand increased. Borosil gave 1:1. That is one for one share of Borosil, they gave one share of Borosil Scientific. Borosil Renewables, right? Borosil Renewables, the company split. Today, if you see the price, right, which was at 36, today, the combined price, this is around 500, this is around 500, right, plus minus. I don't even see that. So because this was free, and then for every 1,000 share, they gave 400 shares of Borosil Scientific. Borosil Scientific. So it is like this 36 rupees. Today, it has become 1,200 rupees, 5 years. Not a single share I have disposed. I'm holding all of them. So this is what in order to buy, whether I should really go for this, I studied for 3 months. For 3 months, it was day and night reading about the Borosil. Literally day and night. Right. So this is, if you want, right, we can keep even one session on that also. I think that mystery has broken something. Glass ki awaaz aayi, doesn't matter. Lab equipments, that's right. Lab equipments, they are all Borosil. Very true. Even अपने खाने पीने की भी items. देखो तो Borosil के glass वगैरह आते हैं, right? They are one of the finest. Okay. So now, extra बातें इसलिए की because the topic is not only short, but you know so much of it, right? So here is, the topic is axilla. Right? Topic is axilla, and axilla. This is the image, not my image. It is from BD Chaurasi only. But yes, from this topic onwards, I'll be adding lots and lots of images of BDC also. Reason? When you'll be reading from it, you'll find it more comfortable. So my idea is to make you so comfortable in medical science. Recently got an email from one of my very senior students. She is in 3rd year MBBS, and she is telling that I'm so frustrated, I'm crying because कहते हैं कि anatomy, physiology में कोई problem नहीं, but biochemist नहीं, pathology and pharmac में there is a huge problem. So I can do one thing. I'm planning on YouTube. I'm planning to start pathology. You guys can also join. Because pathology is, my habit is that first we'll be discussing physio, but this physio will be going at a very fast rate, pretty fast. I mean, the concept that will be covered within say 15-20 minutes, and then we'll be going for patho. So even if you miss something, kuch pata na chale to be, don't worry much, but your horizon, that would improve. And second, many of the students, they have asked for pharmacology. So this is also I'm planning to start. Pharmacology is again very much related to apna physiology, right? So combination of that will give you one very good cutting edge. Kitni sari medicines, kitni sari mechanisms, you'll automatically start learning. But I'll update you when I'm starting. Okay, so this is axilla. In axilla shape is like this, right? It's a pyramid sort of shape. It's a pyramid shape, right? So this is what is called as the apex. Apex means it is the top. Then there are 4 walls, right? There is a posterior wall, right? Then there is a medial wall, apna serratus anterior, right? Then there is a base, there is a lateral wall, and then there is an anterior wall, right? So that's how 4 walls and the apex. Let's put it into the form of our bones, something which we already know, right? First rib, I need not say. Clavicle is now our favorite, and scapula, that is something which is already known to us. We know the spine, we know the acromion process, coracoid process, and the supra, infra, etc. Right? So this is the apex. So the apex, that is the apex. And from here, it goes down in the form of axilla, and here it is, right? So this is the top view. In top view, what we really see is this is the spine, right? That's the spine. This one is the spine. Right, all the way it is going like this. So that's the spine which we feel, and above the spine, the bulge which we feel, and when we press, we feel good. Aha, right? So that is the supraspinatus, right? Which is just above. It is the supraspinatus, posterior part, not the anterior, right? Remember, it is the posterior part, because when you touch on the top, so then that is the trapezius, right? You're watching the posterior part, and which you press, so you feel aha, right? That spine, and just above the spine, one of the point which is very comfortable, very soothing when you press it. Well, say, two emails when you asked about that when we can discuss that relationship, etc. wala session. Very soon, very soon. We'll take that. पर अभी के लिए यहाँ. Then this is subscapularis. Subscapularis, you know, subscapularis, scapula ke niche, right? Which is between, this is the scapula, this is the thoracic wall, and this is the muscle which we are talking about, right? So you are very clear. So here it is, right? It is like a sandwich muscle. Okay, on to this. So we know when now we rotate the body slightly, and this is our supraspinatus, right? And here is the subscapularis, which is seen clearly. And obviously, this is the subclavius, right? We know this part and we move forward. This is the dead posterior view, absolutely. So supraspinatus, infraspinatus, no big thing. And spine, yes, definitely we know that. And here it is, right? This is apna teres minor, that small muscle, important. Teres minor is on the posterior side, right? It is landing on the posterior side. Right? It is the teres major which will be going anteriorly. Kahan hai teres major, right? This is the teres major. Next mein dekhte hain. Okay, right? So this is teres minor spine, you know this part. कहीं पे भी लगे कि we are going very fast, कुछ तो समझ नहीं आया तो immediately let me know, right? Otherwise I'll keep on moving fast so that I can tell you more things. So supraspinatus, infraspinatus, our spine is known, teres minor is known. Here is the teres major, right? Teres major. And that teres major, which we can see that this is the posterior view and it is going anteriorly, aage ja raha, right? And now over here, two major things, that is the head, 1 and 2. These are the two heads of triceps. Where is the third head? Third head is underneath, right? Underneath. So what we see from the back side, right? Because triceps is on the back side. So this is the long head and this is the lateral head. This makes sense. Lateral head because it is laterally situated. So we call it a lateral head. And then this one is a long head. So now we are clear about that. Long head is inside, lateral. Obviously it will be the outside. So here it is now the lateral view, right? Lateral view. So this we are now rotating it slightly. So here is the lateral view, right? This is the lateral head of triceps, right? And that's the humerus, right? This is the humerus. So what we are watching, right? This is the humerus, this one. So what we are watching is that on humerus, then the lateral head, and in between there is something, and this is medial head. This is the medial head. So medial head is not only small, but it is underneath. So if you really want to see the medial head, you have to peel off the lateral head and then you look at the medial head of the triceps. Right? We'll definitely look at it separately also, but this is in general, that's why it is a triceps. Okay. All known to you, supraspinatus, infraspinatus, teres minor, major, right? Major is just highlighted. And just this is the long head, this is the long head, and this is the lateral head. Very lovingly, someone said during class, can we speak? So, दोस्त क्यों नहीं? मतलब आपने मेरे तो ऑफलाइन क्लास तो देखे नहीं. मैं तो बोलता हूँ सारे बोलो, सब साथ बोलो, चिल्लाओ. And I never take presents. क्यों लेनी? Are you planning for some live streams, lectures on YouTube? Yes, Kunjal. Yes. But even and हाँ, एक बहुत बढ़िया suggestion था, right? And I'll be working very sincerely. Just let this house get ready, right? अभी एक week लगेगा. High speed, high yield topics. Say for example, brachial plexus, right? What do you feel? What should be the duration? मतलब आप बोलो कि 3 minute में revision, तो I can make that thing in 3 minutes. If you say 10 minutes for 10 minutes, what should be the duration of these high yield, high speed topics? The topics which are very important. Say for example, we finish axilla, तो ये revision आपको कितने minute में आपको खत्म कर देना है? What should be the time? Hmm?
5 minutes.
4 minutes.
Okay, 5 minutes, 4 minutes.
Sir, at least 5 minutes.
हाँ ठीक है, चलो सेट. बस ये जो पहला थॉट आया वही राइट है. 5 minutes. We keep it 5 minutes, right? So I'll make those and I'll keep on uploading it. So TS major done. As we rotate, what we really watch is over here. So this is the teres major intertubercular sulcus, right? And on this edge, right, the teres major is getting attached, right? So here it is. On the medial edge, there is teres major. On the lateral edge, there is pectoralis major, and in between, right, it is
Lats.
lats. So done. Teres major. You can see it. Half. Now we have removed all the muscles, and what we are watching is the attachments, right? In this attachment, this is now crystal clear that here is the pectoralis major, which is on the lateral edge. Here is the teres major, which is on the medial edge, and in between it is the lats, which is sitting between, right? So this is done. All right. On to this process. This is, here is the subscapularis, right? This subscapularis will come and it gets attached on this oblique ridge, right? On this oblique ridge. So this is how it is attaching to the humerus, right? So this is the subscapularis. Subscapularis underneath the scapula, between scapula and thoracic cavity, thoracic cage. So just for the identification, right? This is beyond doubt. You will know it in a second that we are dealing with the posterior view, and just identify 1, 2, 3, 4, 5, 6. Bol jao, farafat. 1 is
Supraspinatus.
two, two,
Trapezius,
Infrascapularis.
four, four,
teres
Teres major.
6.
Lateral head of tricep.
Tricep.
So this is teres minor and the long head, you know. Cool. Go. Chalo, aage. This is the anterior view. And in the anterior view, our sharp focus is on right now pectoralis major, minor, pectoralis minor. That's the muscle which we are interested in. Because see, this is the muscle. Two muscles, they will be very important. One is the pectoralis minor and second will be the teres major and the first rib. Because these will be the landmarks. Border of first rib, pectoralis minor and the teres major, they'll be playing important landmarks because that is the point from where either the name would change or some structure, right? It will be having some speciality. Thing is, pectoralis minor will be displaying that, okay, how many branches before, how many branches afterwards, right? Okay, so such as fatafat. Okay, the topic is important, it should be 10 minutes. Well, you are right in that, especially the ECG. Arya, 15 minutes. ठीक है. But 5 minutes normally रखेंगे, right? Or I'll try to do it that way. If the topic is important, I might split it into 2 parts, right? Part 1, part 2. That's how we'll take that. But chalo. Yes, you know all those muscles. मुझे बोलने की जरूरत नहीं. You know subclavius, you know supraspinatus, you know the head of the humerus, you know subscapularis, right, which is over there. You know pectoralis minor, you know very well teres major, and you know serratus anterior, right? You know all of them. Yes, and you know even this and this. What is 1? What is 2?
Long and short head.
long head of
Long
bicep.
and short biceps.
Very good. Long head and short head of biceps. And just underneath this, एक दूसरा कुछ दिख रहा है? पतला.
Coraco.
Very nice.
Coracopetis.
Very nice. Very nice. YouTube में comments में किसी ने पूछा था ये. उसने कहा कि वो ये तो, he said that this is coracobrachialis. Then I had to write, gentlemen, coracobrachialis is something which is, you can see just a small slip, which is just underneath it. Right? Okay. Chalo. So this is anterior aspect. I think we talked about. हाँ यहाँ पे वो नाम लिखने थे biceps. That is done. बाकी all same. Forward. And we cover the whole thing, right? So deltoids, in which there are anterior fibers, middle fibers, and the posterior fibers, and the pectoralis major. Pectoralis major has got two groups of fibers. Which two groups?
Clavicular,
And
Manubrium sternum.
very nice. Yes. Which one is superficial?
clavicular.
Clavicular.
So simple bones, right? Just to get a view that this is how all these. So these are all called as the spine, right? These are all spines. These are called as transverse processes, right? And then the ribs are connected. The posterior and anterior end of the ribs, which are on the opposite side, because we are watching it from the back, they are all free, right? This is our all-time favorite scapula. Let's add muscles. So here it is. Unzoom it. Yeah. This is our trapezius shape, kite shaped. It's a kite shaped muscle. We have to understand only two simple things in that. The shape of this muscle, so that is kite shaped. But the muscles, they are given names. Not a big thing. The muscles with the muscle fibers, right? To be very specific, muscle fibers, which are the upper fibers. They are going like this. There is a central group which is going horizontally, and there is a third group which is going up. So we need to give names. Why we give names? Because so that when we will be describing the action of this muscle, we know exactly that even if we close eyes, we know what we are talking about, right? So the fibers which are descending fibers, right? Descending, because everyone will be converging towards the shoulder. So they will be called as the descending fibers, right? They are going down. The things which are at the horizontal level, they are called as the transverse or the horizontal fibers. And the fibers which are going up, they are called as the ascending fibers or the inferior fibers, right? Very clear, simple. This is straps, this is lats. That's the latissimus dorsi, this one, and this is the trapezius. So trapezius gives cut of your neck, and then the V shape of your body, that is because of the latissimus dorsi, right? By the way, where is latissimus dorsi attached?
Humerus and to pelvic bone.
So latissimus dorsi, right? It is attached over here with closed eyes. Humerus to bahut bada ho gaya. Can you be more specific? That even with closed eyes, I should be able to know that, exactly. Where is it attached?
Sir, that lady between two major.
Intercubular
अरे तो बोला था आर्यन, मैंने ये बोला था, ये वाइवा में मत बोलना.
Yeah,
Sir.
between.
Which area is this? Which area is this?
bicipital group.
Yeah, it is also called as intertubercular sulcus, right? That ridge, it goes there, right? And उसके ऊपर से that tendon pass.
No, sir, I was asking that thing you were asking, or
that thing I was asking. Achha. Now we'll be talking about the. So this was our structure ready. Now we'll start inserting. Right? You remember the brachial plexus. Now with those nerves, we are adding the arteries. Right? So now we are making the complete picture. As promised, we'll be starting from heart. And this, which chamber is this?
Right ventricle.
Shabash.
Right ventricle.
Yes. And this one is left ventricle. Correct? Itna sa chota sa portion.
Yes, sir.
Is the left ventricle so small?
no.
No,
No,
sir.
no.
So where is Baki ka kahan gaya?
Ventricle are thick, so it appears.
Slightly perfect.
So left ventricle
Left side. Sir,
it
the
is
major
on
part is
this
posterior.
side.
Rotated and tilted.
It is on the
Tilted.
entire left
Like the
border.
tilt.
Correct. Left border, right? Left side is made up of left ventricle, right? So that's why we were doing like this. This is the right ventricle, but ye pura left ventricle, a big bulk. And imagine it is so big that this is the aorta. So ये यहाँ से aorta निकली अंदर से. Right? This would be the most wonderful thing. Okay, aorta, and this is the pulmonary trunk. Right? Are you getting it? Erase kar do.
Yes.
Right? So why they are in so much love together? Right? This pulmonary trunk. Right? It is going like this, and then aorta beech mein se. Why such strange things? That's where the embryology will come into picture. Right? It will be a wonderful thing to know that how this really happens. And then you'll be learning about the congenital thing. What if this aorta, it comes from right ventricle and the pulmonary trunk comes from left ventricle? Automatically they both become separate circuits. It is impossible to survive. एक चीज ही बचाती है इस बेबी को. बेबी जन्म भी लेता है, बेबी ठीक भी रहता है. What's that? I think it's bit of the truncus arteriosus, right? It is the junction between aorta and the pulmonary trunk. We talked about fetal circulation.
Yes. Yes.
Yes, sir.
So
Yes.
that was a question. के aorta और pulmonary trunk के बीच में junction, उसका नाम क्या?
Ductus.
Ductus arteriosus.
Ductus arteriosus.
Ductus venosus.
Yes. Ductus venosus नहीं है. Ductus venosus अलग है. Ductus venosus क्या है? फटाफट चलो. Anyone? What is ductus venosus?
Umbilical cord to IVC direct without going to
Umbilical vein.
Umbilical artery and
Left umbilical vein to IVC.
Left umbilical vein to
Left.
inferior vein.
Correct. Left umbilical vein to inferior vena cava, so that the blood is bypassed. It is not going into the liver, so it is not the entire oxygen is getting used up, and that rest of the oxygen what is left out is used by the baby. Good. Chalo. So this is the aorta, and from aorta these are the three major vessels which are going out. Right? Let's zoom it. Here is, this brachiocephalic trunk. That's the brachiocephalic trunk. And we have got the left common carotid artery and the left subclavian artery. Subclavians, they will be going for the upper limb, and the carotids, they'll be taking care of the head and neck and the brain. Brachiocephalic, not very far. Immediately, it will be releasing this right common carotid artery, and then it will be continuing as the right subclavian artery. One artery which is going from there, it is the vertebral artery. Right and left respectively. Okay. Let's go further. So this is, we talked about this. It is a double image. So 1, 2, 3, just for the practice: brachiocephalic trunk, left common carotid artery, and the left subclavian artery. Right. In an exam, there should not be any error in such images, right? So here is, now this brachiocephalic trunk and the left subclavian artery, we need to change the name. So that's the subclavian artery, which is, so right subclavian artery. When do we say right subclavian artery? As soon as the right common carotid artery exits, this trunk portion is over. So trunk is only this much. That is the brachiocephalic trunk. As soon as right common carotid artery leaves, rest of it now it is called as the right subclavian artery, right? It is the subclavian artery. Subclavian because it is underneath the clavicle. नाम ही है clavicle के नीचे. So here we have definitely we have removed, say on this there will be manubrium and then there will be clavicle. Because if we try to do this, we don't feel this artery. It is such a big artery. So it has to be given good protection. That's why it is properly covered with the bones and the thick muscles. Here we have removed all the muscles. We have cut the ribs. We have removed even the manubrium sternum. We have removed the clavicle, and then we are watching it. Right? No, we cannot palpate. We cannot palpate. Can we palpate heart? Right? It is just underneath. No? We cannot. Right? So that's already talked about. And here it is. Oh, sorry, same image. Right? Vertebral artery. Yes, you know that. Even we discussed this. Internal thoracic artery. Right? Internal thoracic artery. Right? And then they are going all the way. So The question which you asked on that day, that is there anything like external thoracic artery, right? Today you'll get the answer because we'll be discussing all the branches. So lateral border of first rib, right? No mystery, lateral border of first rib, and that is the point from where we'll start telling this subclavian artery as the axillary artery. And it is the axillary artery who is our chief of guest today because we'll be discussing it full. But as such, we'll reach all the way to the palm. So that axillary artery continues. So here is the axillary artery, right? Axillary artery. But kahan tak? Right? At one point, we now say कि अब तो हाथ आ गया. Now तो the arm has come. So we need to change the name. Arm in Greek language is called as the brachial. So we need to call it a brachial artery now. So that point is now comes the teres major, right? Teres major. So this is the point. That is from the teres major edge, the lower margin of teres major. That is the point when we'll say, आज से तुम्हारा नाम brachial artery, right? And brachial artery continues. So these are the points. Whenever you come across such specific things, remember they are the questions for all your competitive exam. All matlab apne at least ye next or wo wale exam mein, these are the points. People say anatomy is difficult. Kaisa question pucha? Teres major, teres minor, pectoralis major, pectoralis minor, right? The level at which the brachial artery starts. What's the big deal, right? Even if these four options are given, they are not confusing. It is just a matter of understanding. And today, those who have watched the video, they must be knowing that we'll be talking about something like this, right? This is also very important, and we'll be spending good 5-7 minutes so that you understand those three areas, quadrangular space, triangular space, and triangular hiatus very properly, because the questions, when they come and when the options are there, so then you should not be confused, right? The moment you do this, the complete picture will be coming in front of you. So here it is. Teres major, lower border, brachial, it is now called as the brachial artery. Lower border, lower margin of teres major. During revision, we'll be watching only these keywords. They are called as the keywords. We'll be going through those keywords so fast that yes, we'll start the stopwatch and we'll see that within 5 minutes, we should be able to revise this. I say revision ke videos bhi I'll make. So धड़ाधड़ फटाफट we'll just revise it. So you don't have to even worry about शुरू किया and खत्म. Now that artery is coming up, right? That artery came down, brachial artery. Brachial artery divides. From this point onwards, things are simple. Absolutely simple. Radial artery and the ulnar artery name is as per bones. Radial side per radial artery, ulnar side per ulnar artery. Radial is lateral, right? Because you know that the radius itself is lateral. Ulnar is medial. So no need to write. All good. Okay. Further, the concept. This concept we discussed when we were discussing the arteries way back in general anatomy. We said that whenever the artery returns, sometimes, so this is the direction of the flow. Blood is flowing into this direction, but some of the arteries, they go back. When they go back, so that ulti Ganga, that is what is called as the recurrent artery. Against the current, it is going back. Why it has to go back? Because it will be meeting someone. It will be meeting someone, and that artery, when it will meet, that junction, that point, is called as the, what is the name of this point when they both meet? It is called as
Anastomosis.
anastomosis. Anastomosis. So anastomosis is like a diverted path. That path is normally open, right? It is open, blood passes. But in case of if there is any major obstruction, so these collateral circulation, they are called as the collateral circulation, they start. So they are like the backup circulation. No big thing. Normally they remain open, but not that effective, right? Some blood really goes for the distribution, but in case of any obstruction, it becomes major supply. You'll see this thing fantastically in cases of heart. In cases of heart, right? In heart, as you exercise, right, you'll find that the collaterals they'll start developing. So even if one bad day, right, we'll not say one fine day, it will be one bad day. If any of the coronary vessel is obstructed, right, person would get pain, but those coronary circulation will keep those heart muscles alive. It is not so that with that that collateral circulation person will be able to run marathon. No, but at least he would survive. He would survive. It would not be like just cut and go. No, it won't happen like that. Right? So that's why fitness is important from this perspective. Being a doctor, when you know that, yes, these are the advantages, so then the motivation level should be skyrocket. Right? Answer of one of the email that I do it for 1 day, 2 day, 3 day, 4 day, and on the 5th day, my motivation is lost. No, it is at that point when you read about the heart, you talk about the heart, you send a mail to me, right? Do talk, right? Motivation should not be going down at any point of time. It's that vital. It's that vital. Be in touch. Right, so this is the radial recurrent artery that will be leading to anastomosis. There is another word which I explained it in that. And today we'll see that also. The circumflex, whenever the word circumflex comes, it means it winds around. It winds around, right? So anterior to posterior, posterior circumflex, so it starts from posterior and then it comes anterior. Then they both meet, right? So that is what is called as the circumflex. It will come. Now, right, radially recurrent, and it meets radial collateral artery. Collateral is parallel artery. There is one another artery which will be coming from the top and it will meet over there. And that is what is called as the radial collateral artery. We take both of them all the way down. This is the point where we take the pulse, right? So we take the pulse over here. We take the pulse over here and we don't take the pulse over here. Reason. This is a big area, flat area. It is pretty superficial, so that when we touch this radial artery, right? Radial artery, it rests on a solid surface. So that's why we can feel the pulse more properly. Right? If there is more of the soft tissue, so if we try to press the artery for the pulse, artery will sink. When it will sink, we won't be able to feel the pulse that properly. To feel the pulse, the 3-finger method, right? To feel the pulse, the 3-finger method. Out of that, the first finger, right? The direction of the flow is this. This is called as adjustment. This is called as feel. This is called as pressure. So with last, you just put the pressure, right? Put the pressure and then slightly release it till you start getting the pulse, and you have to feel the pulse with your long finger, right? And then you adjust, increase or decrease the pressure with the first finger so that you feel the best pulse, right? So this is how you apply the pressure with the third finger, right? Adjust this in such a way so that you get the best feel into this. So that's why when you put, right? So immediately you start adjusting and then you feel the pulse like a thrust. Same thing is over here. Finger placement. Right? It is just the tip. Just the tip. It is also called as the pulp of the finger, right? It is also called as the pulp of the finger. In surgery, you will know that this pulp of the finger is very dangerous. Right? If there is any infection to it, can spread very fast. Right? It is a tight space, right? And there are sheets, and in that, if it develops, then it is like a pocket. Anyway, it will come when we'll be discussing the hand. So this is called as the pulp because nerve endings are more. You'll be able to feel more, much better. Right? Okay. So radius and ulna, as they go down, they make this area. This is what is called as the palmar arch. Right? They are called as the palmar arch. Right? Palmar arch. Two palmar arches. One is superficial, one is deep. And I used to forget always. Superficial is made by what? And deep is made by what? And teacher used to ask this question only to me. Right? And every time I used to forget. Then just before the final viva, this is what I did. Right? First, the theory part. This is शराफत से when we say कि हाँ, right, this is what, this which artery, this is the ulnar artery and it is the, हाँ, right, तो ulnar artery is making superficial palmar arch, हाँ बोलने में बहुत अच्छा, right, वो तो जब सामने हो तो सब याद रहता है. Then superficial palmar arch, right, that is by ulnar artery, ठीक है, and this is the deep palmar arch. This is the deep palmar arch, this one, with this one, and that is formed by the radial artery. Then this is what is called as the visual mnemonic. Visual mnemonic is when either you speak it like this, that this is the deep palmar arch, or it is the radial artery, right? But the visually, when you write the deep palmar arch and change the color, and then this is by radial bus. This is what is called as the trigger. This is what is called as the trigger. During revision, you will never be going like that, okay, deep palmar arch is made by radial. Kabhi nahi. You will always watch this. Next. Train your brain for such things, right? And through medical, through and through, even in surgery, even in gynec obstetric, when we'll find that kitne complex all those procedures. No, मतलब सुनने में अजीब लगेगा, but I would say if your age is right now 19 years, right? Say 4 months, randomly I'm picking up 4 months and 3 days, right? So then go back this much. That means when you were into the womb of your mother and now you are coming out. Now you close your eyes and then you learn all the stages, stage 1, stage 2, stage 3, stage 4. Right? And when you come out, you just cry, right? You'll always remember it. Because anything which happens on you, you always remember, because that is, anyone who has gone to Vaishno Devi? Who has gone to Vaishno Devi? नहीं, seriously, बहुत बढ़िया बात बता.
Yes, sir.
अच्छा, वैष्णो देवी में there are two paths, right? One is the Hathi Matta, that is the main one, and second is that Gulshan Kumar made that another shortcut, right? Well covered, badhiya, right? We always go by this Hathi Matta, much tougher. I took many of the students over there, कि चलो चलते हैं, right? Very steep, but then there is one place, Ardhkumari. At Ardhkumari, मतलब इतना सा दरवाजा है, जमीन मतलब दैट मंदिर, राइट, छोटा सा, जैसे जाओ अंदर, राइट, यू जस्ट स्क्रोल थ्रू इट, ऊपर से पानी गिर रहा है, पत्थर है, यू माइट ब्लीड, लगी चोट लगी, एंड देन यू मूव ऑल द वे एंड देन यू कम आउट, राइट. आर्मी पीपल आर ओवर देयर, आपको खींच के बाहर निकालते हैं. द मोमेंट एनीवन हु हैज गॉन थ्रू दिस पार्ट,
No, sir.
ठीक है, अब जाओ ना तो जरूर जाना. द रीजन इज कि वहां पे देयर इज वंडरफुल बोर्ड, इतना बढ़िया बोर्ड है. एंड दे ऑलवेज से कि जाके पढ़ो. दे से कि कम जो 1000 में से 5 लोग भी यहाँ पे नहीं आते. बट वंस यू विल गो देयर, seriously, first time when I saw that, I cried, right? The board is the entire path what you covered, it is exactly like mother's birth canal. सो इतनी तकलीफ के बाद आपने जन्म लिया, सो दिस इज लाइक योर सेकंड बर्थ. आज से थोड़े पाप कम करना, राइट? इट इज दैट गुड. एंड दिस इज लाइक I been to Vaishno Devi more than 20 times, but this experience, right? It is every time. It means you go, you'll feel that vibrations. उसके बाद पता है वैष्णो देवी में there is एक डाकुओं का वैष्णो देवी है. It is deep in jungle. That डाकू is very good friend of mine. तो वहां पे आप जाओ and they give you so much of इज्जत. हाँ सीरियसली, तुम हंसना नहीं, वे बहुत अच्छा आदमी है, right? पूरी गैंग से मिलाया था. one of my अभी तो see it is with more than 30 people died, but कभी let's see, फ्यूचर में प्लान करना हो तो एक बार करते हैं, right? I did that thing before about 5-6 years back. बैच बन गई and everyone said कि बस done. You know, we went, just we planned it in 3 days. मतलब आज जैसे ट्यूसडे है and we said कि चलो चलना है, तो then suddenly they said कि हाँ हाँ चलते हैं, and on Saturday we all met in Delhi, और फिर वहां से फिर सब निकले for Jammu, and it was a great fun. So वो तो जो कहते हैं ना, it is like माता जी जब बुलाती है तब वो ऑटोमेटिक हो जाता है. But think of, मतलब कभी भी अपने प्लान करना, I am always ready for that place. And I'll be your very good guide. I can show you so many things. वैष्णो देवी के नीचे एक शिव जी का मंदिर है. Anyone knows that?
Yes.
हाँ,
Yes.
बीच में बंदर आते हैं ना.
Yes, sir. That is much
Yeah.
scary.
But you,
They are much more
नहीं,
scarier
पर
than
हंसिका
any
पता है,
part.
if you do this, बंदर को उंगली दो ना तो वो बंदर आके उंगली पकड़ लेता है. He'll not harass you. All the way he'll take you to that place. And then there is a huge shivling, bigger than our size. And the water which is falling, right, that is so clean. Again, it is very good that you have been there, because कहते हैं मोस्टली तो लोगों को पता ही नहीं होता, जब वहां से रिटर्न होते हैं वो नीचे सीढ़ियां हैं, लोग सीधे सीधे निकल जाते हैं. Good. So here it is, right? So deep palmar arch. Now you will not forget that deep palmar arch is by radial arch.
Radiant.
Yes, radial arch. Now slightly, I'll not say complex, but something which is vital from the exam point of view. ये question आते ही हैं, and definitely MCQ में भी आते हैं, and in viva में. Here is the axillary artery. Axillary artery which is continuing, and this axillary artery is passing underneath the muscle which is the pectoralis minor. Right? Pectoralis major is on top of it. Right? So we are talking about pectoralis minor. Don't make a mistake of major. It is minor. Right? So this minor is getting connected to that coracoid process. So we have got now axillary artery divided into three parts. One part which is before, which is underneath, and third is which is afterwards. Part one, which is before, part two, which is underneath, and part three, which is after. And it has got so many branches, right? So part one has got one branch, part two has got two branches, and part three has got three branches. Simple as that, so easy to remember, right? The main muscle in which this we have to focus is the pectoralis minor. Let's watch. We start with the first part. This first part, this is, right, this is internal thoracic, right? Internal thoracic, which was coming out from the subclavian, right? So we know this part. Then this is the first part, which is before, and it is called as the superior thoracic artery from the first part of axillary artery, superior thoracic. Very short branch, but yes, branch is a branch. Teres major, yahan I have put because of this border, and it is this border which is telling that from this point onwards, we'll be calling it brachial artery, right? So the entire game is of only this much portion, that is from the edge of the first rib, outer edge of the first rib, to lower edge of teres major. That much portion is the axillary artery. Okay. She tastes like sweet apple pie. Yeah, ready to move from BD चौरसिया. मतलब BD चौरसिया, yes, BD चौरसिया में भी है ये. But in BDC, you can even go by chopper, वो भी easily. हाँ यार, chopper में जा सकते हैं, पर वो मजा नहीं है. चलते चलते जाओ तो मजा आता है. Especially when you start at 4 o'clock in the morning, 3 o'clock in the morning, and by the time when you reach to that Sanji Chat, right, it is early morning. Wonderful atmosphere. Huh. So that was the first part, right? The first part when we, so this is the internal thoracic, this one is the internal thoracic, then we have got the superior thoracic, and here comes, this is the second part now. In second part, there are two branches, one which is over here, because minor, and its four branches are 1, acromial, P, pectoral, C, clavicular, D, deltoid. Done. Finish. Move further. Right? In Viva, when you speak like that, it shows that you know the structures. You know the structures. Right? At the same time, it will help you immensely during the surgery. When you'll be learning surgery, immensely. Further. So now clear, right? Acromion branch, pectoral branch. We have got the clavicular branch and the deltoid branch, right? So this pectoral branch, which will be supplying to the breast, right? Clavicular branch, which will be going deep to pectoralis major, and it will supply subclavius muscle. It will be supplying the subclavius. Say, clavicle ke liye to ja hi raha hai to subclavius is more important, right? So it will go there. Deltoid, it has to go in deltopectoral groove, deltopectoral, deltoid and pectoralis major's groove, deltopectoral groove. That is where it will go, right? And that's how all these four are distributed. So we finished part 1, we finished part 2, and now we move on to the part 3, third part. Third part of axillary artery, which is beyond pectoralis minor, right? So first one, the subscapularis. Now see the muscles which are near over here. This is the branch which we are talking about, right? This is the branch. This is the branch we are talking about. The nearest muscle is this. This is the muscle, that sandwich muscle. Right? It is subscapularis. So that's why the name is also subscapularis, right? So subscapular artery. Subscapular artery, it is third part, right? So here it is. This is the subscapular artery. The rest is all easy. This is our humerus. So one artery which will be winding around from front and one from the back. So one which is winding around, it is called as circumflex. So it is the anterior circumflex humeral artery. Right? And yes, you know that posterior. So that is the posterior circumflex humeral artery. And then comes the teres major, and then axillary would say, "Ke chal bye," right? Now the name is changing to brachial, and all the best, and it goes, right? So journey of axillary artery completes at this point. Now comes this part, right? You'll do this thing along with me. Absolute clarity is vital. What you will be watching is, right? Make this finger, this is easy, right? All you have to do is say, put it like this, right? Like this, and then above finger, you will take it on your side. Bas baki, just keep it as it is. Just keep it as it is. This is important to learn one very confusing concept in a very easy way. So what you are watching, it is as if, think it like these are your hands. So what you'll be watching is actually this view, right? And this is the posterior view, right? Posterior view of what we are about to understand. So patient is aage, and we are watching the patient or the person from the back side. So two fingers like this, put it like this, and this finger on your side. Plus, this should be the position. Clear? Now. Let's fast forward. Let's say this is the posterior view. Now, in this, you will understand. Say this will be your right hand. This will be your left hand. Left hand is lateral. Right? You are understanding it in such a way that this is the lateral side, right? And that one is the medial side. Yes. So when it is lateral side, at least this part is easy, that it has to be humerus. This is humerus, right? And when we do this, so that's the teres major. Now you remember teres major goes anteriorly. You know?
Yes.
Major goes anteriorly. teres minor posteriorly. So simple, right? Teres minor posteriorly, teres major anteriorly. And this is the edge of the humerus. So on the humerus edge, what was there? On the posterior side, we saw that lateral head of triceps. है ना?
Yes.
So this is also clear, lateral head of triceps. And then the head which is left out, that is the long head of triceps. ठीक? So we have got now teres major, teres minor,
Again,
lateral head
explain.
of triceps, and the long head of triceps. If this much you have understood, done. इतना बड़ा topic
Please
खत्म.
explain once again.
Yes, yes.
Please explain once again, sir.
Sure, sure. See. Right, two fingers. Right. And this is a posterior view, right? Posterior view. If it is posterior view, so then, and this is lateral side, so this would be the lateral head of triceps. And this one would be the long head of triceps. So this is the lateral, and I'm writing 3 triceps. And this is the long head of triceps. So far clear?
Yes, sir.
Okay. Now put both 2 fingers over here. But then we realize that no, there is like this, right? This muscle, right? This finger is what? Which is anteriorly?
Teres major.
Teres major.
Yes,
Teres major. That's
Teres
right.
major.
Teres major. So let me change the color, right? So that is anterior. So this, that's why I'm drawing it like this, right? So this is teres major. And then there is one more muscle, right? Which would be like this. This I'm drawing thick. So this is like this, right? This is teres minor,
Minor.
Minor.
right? But so now can we see that we have created 3 spaces? We have created this space. We have created this space. We have created this space. Out of which one is quadrangular, right? This one is quadrangular, and this 2 and 3, they are triangular. These are the spaces. They ask long questions on this. They drill you on the Viva. Chalo, tell me the boundaries of quadrangular space. And they say, kya re, ab kya? You can say it right now, right? Without my teaching. What is the lateral boundary? What is the lateral boundary of quadrangular space?
Lateral tricep.
Humerus. Humerus.
Lateral head of
Humerus. And yes, please go ahead.
lateral head of
Lateral head of triceps.
That's right. Humerus and the lateral head of triceps. Okay. What is the medial boundary?
Long
Long
head
head
of
long
of
head
tricep.
of
Long
head
head
of
of tricep.
And the superior boundary?
teres minor.
Teres minor.
Teres minor.
Inferior boundary. Inferior boundary.
teres
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 major.
major.
Teres major.
Teres major. Now add something to it to make it look more sophisticated. And seriously, examiner ka dimag bindas kharab karne ke liye. When they feel ke wow, kya knowledge. It's so easy, right? See, these structures, what you learned, they are not lines, right? So, यहाँ पे muscle है, ठीक है? You want to define this boundary, ये boundary. So what would you say?
Inferior edge of the muscle.
Shabash. So now you will say, right? देखो क्या complex लगता है, but it is as such कुछ नहीं है उसमें. The superior border of quadrangular space is formed by the lower edge of teres minor. And wow, talia, right? Then comes this. Right? Then comes this. The inferior border of quadrangular space is formed by the upper edge of teres major. Irshad.
Major.
What about this? The medial border is formed by the lateral edge.
Lateral edge of.
And now you know this, right? शायरी हो गई. But when you speak it in a sequence नहीं, मतलब आप ये homework में try करना, आंख बंद करके, मतलब this picture in front of you, and then you speak, explain the quadrangular space. Trust me, means when you describe like this, no, examiner becomes speechless. मतलब this is the trick. सही में बोल, मतलब they, I've seen that, right? So same way, this is the triangular, this is the triangle, right? Actually, this will be the homework. Without image, right? You will be sending me one audio clip. You'll be sending me the audio clip. ठीक है? Be honest. जितनी बार practice करनी हो कर लेना. But then, without watching the picture, right? This picture should not be in front of you. You will be explaining the quadrangular space, triangular space, and the triangular hiatus. Right? We'll just talk about it. This is what is called as the quadrangular space. This is called as the triangular space, and this is the triangular hiatus. Right? It will be called as a triangular hiatus. So you'll be explaining these three things in a single shot without mistake, and you'll be sent the audio clip. Okay? It will be a great fun. By the time when you'll finish that, you'll be so pleased with yourself. Right? Concept clear?
Yes.
Yes, sir.
Yes.
Yes, sir.
So once again, we are on to the posterior view, and here it is now in detail. We see this is the quadrangular space, right? That's a quadrangular space. And this one is the triangular space. And then this is what is called as the triangular interval or the triangular hiatus, because this is a very small space, right? But importance is quite good. You know the boundaries, you know how to explain it, right? Okay, on to the next one. So we have, there was one email regarding brachial plexus में nerves mix हो जाते हैं, ठीक है? I prepared this thing in the morning only. मैंने आपको मेल भी लिखी कि तू भी मेरे जैसी है. Yeah, that's right. मैं भी भूल जाता था. So it is completely fine. Remember PAR. PAR means what? Beyond. PAR excellence. PAR excellence means beyond excellence, right? When things are so good. So remember PAR. What is PAR? This is P. We are talking about the posterior cord, right? In posterior cord, there are two nerves which are coming out, right? Axillary and radial, right? The radial is bigger, so that's why drawn bigger. This whole thing is like a trigger. So now you will never make a mistake. कि posterior cord में से even किसी ने बिल्कुल, even if we are in coma and then anyone asks, so be it will be like that posterior cord, yes, PAR, upper axillary, and then the radial. Will never be making a mistake. That is one. Second, remember two M's never meet, right? Two M's never meet. So वो कैसे? This is, we have got now the medial cord. Posterior cord khatam, right? And the lateral cord. Medial cord and lateral cord. Two M's never meet, right? So that means from medial cord, musculocutaneous, no, it will never come, right? It is the lateral which will be giving to musculocutaneous. So medial automatically sorted out for ulnar, right? So this is done. And then the main now, there is one more main now, which is the median now. Median now, medial and lateral, they will be contributing to form median now. Watch it. You have finished axillary, radial, ulnar, right? Median, and the musculocutaneous, right? 1, 2, 3, 4, and 5. All 5 major nerves complete, right? Rest are all small nerves. So these are the nerves which will be taking the entire part. जैसे दरवाजा बंद कर देना, सुनो, ये दरवाजा बंद कर देना. Right? So these are the 5 major nerves. You should not make mistake in these 5 nerves. But it's nothing very, very vital. Right? So this also you can just revise, but I hope now onwards there won't be any confusion. And it is good. And by the way, don't write sorry. Right? कि अरे sorry मैं भूल जाती हूँ. तो क्या मैं भी, अरे आप तो you all are brilliant. I mean, you guys revise so sincerely. I was never so sincere on truly speaking. So now this is our idea. Auxiliary nerve. Do you remember auxiliary nerve? You remember that auxiliary nerve?
Yes.
Auxiliary
sir.
nerve goes to the neck and क्या बोला था? It is called as surgical neck. है ना? क्यों surgical neck? Because when the axillary nerve is passing through and if there is fracture of neck or femur, तो axillary भी गई. Right? So this axillary nerve, right? It is coming out. It is coming out. Right? Then, and it is from this quadrangular space, it is coming out. From this triangular space, there is circumflex scapular. Circumflex scapular because it will be winding around, the scapula. So that is the circumflex scapular. And then this chota sa portion. Area is small, but big artery. Profunda brachii artery. Profunda is profundus, khub, large. Brachii means arm. This profunda brachii artery is coming. Now, all the arteries, they are associated with one or more nerves. Arteries and nerves, they bundle together. Right? So that's why it is also called as the neurovascular bundle. Right? It is always in the bundle. So this profunda brachii artery, right? That artery which will be coming out, but it is accompanied with radial nerve. Radial nerve is branch of which cord? Fatafat.
Posterior cord.
Inferior cord.
Posterior.
Follow fast. Right? So up profunda brachii artery, big artery, right? It will be coming. By the way, if you see this is the humerus, so ye area kaun sa hai? Which area is this? Forget about the muscle. This area is what? Is called as what? Long bone mein, this area is called as what? This is the head. This area is what?
Shaft.
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 Shaft. So this means whenever there is fracture of shaft of humerus, so there will be profunda brachii artery will be broken, but it is accompanied along with the radial nerve, right? And this radial nerve is so boss, right? It puts the pura groove dalti hai, right? That is what is called as the radial groove. So there will be a groove on the shaft, and that is called as the radial groove. Now, unfortunately, radial nerve खुश होती रहती है. देखा मैं तो groove में बैठी हूँ, but boss जब bone break हुआ तो तू भी गई. So that's the reason it will lead to radial nerve palsy, right? Because it is into the groove. In the brain also, if this is a carry-on, if there is any fracture, so then there is a branch of middle meningeal artery which is into the groove. So if the bone is broken, so that artery is also snapped off. Toot gayi artery. Now that artery, because it is into the bone, so it will not constrict. Because bone ne usko pakad ke rakha, so its caliber will remain open. It will keep on bleeding, right? And the blood keep on getting collected, and that is what is called as the hematoma, right? When we say, so that blood, when it accumulates, because it is outside the dura mater, so it keeps on compressing, it compresses the brain, right? And then slowly person goes into the deep state and passes away when the intracranial pressure increases so much. Treatment is simple. Bar hole, take a drill, right? It is a drill, not ye mistri wali drill nahi, wala drill, but concept is same. Drill, right? And the moment it goes into that, you'll get tuck, right? And then blood starts oozing out. Put a catheter and the blood comes out, decompressed, and patient would be fine. Then you can go for surgery and you can treat rest of the case things. Yeah, I have been to Vaishno Devi. Acha. It takes time. You should patient this trick. Audio of what? अच्छा मैं बताता हूँ बाद में. So major things. For the quadrangular space, we have got axillary nerve. For the triangular hiatus, we have got the radial nerve. Correct? And for this triangular space, right, we have got the circumflex scapular artery, right? So this is our trigger. Quad space, posterior circumflex humeral artery, and the axillary nerve. Right? हाँ, just ले लीजिए. And the profunda brachii artery, right? That would be accompanied by radial nerve. Remember radial groove, right? ये एक याद रख लेना. Radial groove. Groove means it is the edge, right? Edge, which will be on the humerus. So when we'll see the bone, we'll see a sharp angular edge, right? I say if this is the bone, it is in this angle, like this. Big one, you just can't miss it. This we talked about. We are now moving on to our last part. This is the thymus, right? It is the thymus, which is one of the important sign. So this is the thymus, which is one of the important component of lymphatics. Lymphatics, which is associated with our immunity. Now, in this region, the vital thing is carcinoma of breast, because it is one of the most common carcinoma in females, right? It is one of the most, and it is deadly. Just that's where. Just in a while, I'll explain what was the idea. These diagrams look scary. Scary till you don't know it. 10 minutes, you'll know everything. Then you will not find scary. So see a breast, that is very common, and that's why it will be carrying tremendous importance in surgery, tremendous importance in radiology, because radiology may see a breast, right? So what's the logic? Because carcinoma of breast, if it is malignant, it gets spread to ribs, lungs very fast, right? And that is the point where you can watch all those irregular broken areas in the form of ribs, and that indicates that it is spreading onto the opposite side. That is what is called the secondary. Right? Chalo, let's understand this. The concept is lymphatics. The concept is lymphatics. Lymphatics is our fighting system. Right? So whenever there is any of the malignancy, so these lymphatics, those lymph nodes, they will be enlarged. They'll be stony hard, because their function is to fight against any of the, they are called as the pathogens. Right? Pathogens means those who are creating the pathology. Right? Those who are creating the pathology. So that's why we have got the lymph nodes. Now these lymph nodes, they work in a very systematic pattern. Right? They will be draining area. You will use the word drain. Draining the areas. Draining the areas means whatever the kachra is into that area, that is taken by them. Right? So let's say these are the lymph node, whatever the name it is, right? Then similarly, there is other area from there. It has drained all those pathogens जिसके साथ लड़ाई हुई है वो सबको पकड़ के चलो बाहर, right? This and all of them, so they will be draining into one area, right? Then one area. Then all these they will be draining into one more area, and then they will be going into inferior vena cava. So thus there are groups. In chest, we have to understand this pattern. So first we'll see that where are they? Very easy. See anterior wall, right? We are watching the anterior wall. So this, right, all these, right, these are the lymph nodes, right? These are the lymph nodes. These are the lymph nodes. But I have highlighted, turned those lymph nodes into pink, on which we are talking about. So this is the anterior group, right? Makes sense? Right? We are starting with anterior group. So because it is right in front. So frontal portion of the breast that is drained by this anterior group, and that's why very rightly it is also called as the pectoral group. Right? It is called as the pectoral group because majority of the breast tissue that is draining into these nodes. Lymph nodes, whosoever is near tissue drains into that, right? It will not go at a far distance. It drains into that. So this is majority of the anterior portion. Next. So this is done, right? So that is the group. Where is it? It is on the lateral edge of pectoralis minor. So here is pectoralis minor highlighted, right? This pectoralis minor highlighted, this entire muscle. And on the lateral edge, this is the area, right? Perfect. So this is the first point, done. Anterior portion done. Move further. Now this is absolutely on one side. So this is what is called as the posterior group. It is almost into the axilla. So this is the posterior group of lymph nodes. So that would be scapular, right? Posterior, that way, scapular. Right. So scapular. It is along what? It is along subscapular artery. अरे वाह, subscapular artery. Subscapular artery याद है? Third part of axillary artery की largest branch was subscapular. Right? So this is clear nowadays. It has made the reference. Itna पीछे, what it is doing, it is supplying what is called as the upper part, apical part. Arey, someone's. It is called as the apical part. This part is called as the apical part. So in surgery, when you have to really examine the female breast for the carcinoma, so why you go for this apical region? Because it is the apical region that is where the posterior nodes are there, posterior group of lymph nodes. So one is the anterior group of lymph nodes. Second is the apical group or the posterior group of lymph nodes, right? These are the posterior, which is on to the near to the subscapular artery. So this is done now, right? So here is our posterior group. So done, right? Posterior group done. Right? This is the axillary tail, right? Axillary tail. Apical आ गया है, sorry. मतलब हाँ ठीक है. So we have got anterior group we talked about and the posterior group we talked about, right? Posterior. And this is on both the sides, right? The third group is called as the lateral group, right? Third group is called as the lateral group. Third group is called as the lateral group. Now see this lateral group. It is in between, right? This is, but this group is for the upper limb, right? It will drain the upper limb. So we have got anterior group, posterior group, lateral group is for the upper limb. And then comes this one, this is the central group. Right? This is the central group. So this central group, the complete drainage is like anterior for the anterior wall, posterior is from the axillary tail, lateral group, which is from the upper limb, and then it will drain into this central. They don't even open the door. Just sorry. Oh, sorry. So we were talking about anterior, posterior, and the lateral, right? Anterior, posterior, lateral. Anterior wall, posterior is that axillary tail, lateral from the upper limb, and they will drain into the central one, right? Central, and this central will lead to the apical. This is the order. Then. So that's the apical. Apical is just infraclavicular lymph nodes, just underneath the clavicle. Now, what does that mean? Let's say patient of carcinoma breast comes. When you examine under the clavicle, right, and you find hard stony nodes, so you know it very well that it has spread almost to the entire breast. Right? Makes sense? Because they started from anterior wall to posterior wall to lateral to it will went to central, and from central now it has reached to apical. Definitely examine opposite side, right? So that you know that how much involvement is there. Because for the breast, entire staging of the CA breast, that is based on these lymph nodes. More the spread, obviously stage is at a higher level and the prognosis will be bad, right? So this is called as the infraclavicular lymph nodes. These are the location. So that's it for today, right? Now, let's go for a revision, right? I remember that. Audio ka na? Yes. Audio. For the audio, do you remember this, right? We talked about this. So this is the quad space, quadrangular space. This is the triangular space, and this is the triangular hiatus. The audio.
Triceps hiatus.
So what you have to do is formation of this quadrangular space, triangular space, and the triangular hiatus without watching this figure, right? Without watching this figure. So you have to really speak. You have to speak. That boundaries of that is what is how the superior border is formed, how the inferior border is formed, how the medial border is formed, how the lateral border is formed of quadrangular space onto the triangular space. Superior, inferior, and this one would be the lateral. Similarly, for triangular hiatus, this would be the lateral, this would be the medial, and this would be the superior border, right? Thus, you have to explain, you have to just speak straight sentences, right? And you have to, without any error, and that is what you have to send, right? The audio clip is because when you speak, not only your concepts will become more clear, you'll be more confident, right? और ये इतना बोलने में, you might have to revise it 5 times, 10 times. कहीं एक गलती हुई, cut, again record, right? You have to send me something which should be without any error. Paka? So that's the homework. That is the audio clip which you have to send, right? And I save this and let's start the timer. We'll revise exactly under 5 minutes, right? So, back to begin. Timer starts now. So here is axilla, and this was our pattern of the revision. Axilla, apex, and it has got the posterior wall, anterior wall, which is open, medial wall, and the base lateral wall. Yes, that's what we'll be watching, right? Just look is enough. No need to speak even first rib, clavicle, and then that's the supraspinatus, acromion spine. Yes, clear, right? Slightly unzoom. So here it is, the subscapularis. All good, right? It is subscapularis subclavius, that was just underneath. And we have spine, rest all good. Teres minor. This is on posterior side, so teres major on anterior side. Done. So that part is already finished. Yes. Triceps, in triceps, we have got the lateral head and the long head. Lateral head and uske niche medial head. Clear. Right? Over here. lateral view, and this is the medial head. We already saw that, right? So this is all clear, right? No doubt about it. This is major seen, right? यहाँ पे. And this is the intertubercular sulcus, yes, and that's our trigger, done. Right? But this major be revised okay later. Let's see revise. This is done. And over here, these are the muscle attachments. Right? So subscapularis, it's done. 1, 2, 3, 4, 5, 6. You revise it, right? And here it is, pectoralis minor, that would be the thing. Rest all muscles, they are coming again and again, and all clear, right? Biceps, then long head, short head, anterior aspect, subclavius, teres major, serratus anterior, right? Done. Deltoid pectoralis major, obviously, these are the bones. This is clear. All those fibers descending, transverse ascending, but that's it. That was the trapezius lats, all good. And for here, branches lie brachiocephalic trunk and the right subclavian and the right common carotid, left subclavian and left common carotid. And then there were vertebrals. They were making basilar and they were making out the circle of Willis. Right? This is all good. Same thing. Right? The point is first rib's edge. And from there, the name changes to subclavian. Name changes to this. Just. So our 1 minute got wasted, right? Subclavian will finish this, right? This is left subclavian, done, right? These are the internal thoracic going deep. And then we have got the axillary artery, part 1, part 2, part 3, right? And this is going down teres major edge. That from that onwards, it is brachial, right? And that's the keyword which we saw, teres major. That's the keyword. Going down radius ulna, radial artery, ulnar artery, radial recurrent. And then it will be meeting radial collateral, which will be coming from the top. And then these are the two arches, deep arch and superficial arch. And our trigger was this, right? So this is like, we remember deep arch is from radial. So obviously superficial arch will be from ulnar. Then pectoralis major, 1, 2, 3, right? Branches, 1, 2, 3. And this first one, which is the superior thoracic. And then we have got the second part, this is the lateral thoracic. It is on the lateral side of, this is thoracoacromial APCB, right? You just remember this acromial, pectoral, clavicular, and the deltoid. On to the further one. This is D, right? That's where it is going. This is the largest part, third part. This is the subscapular. And then we have got two circumflex, anterior and posterior, so 3 parts completed. And just doing this, right, will tell everything. We'll jump on to this image. And yes, teres minor, teres major was in front, teres minor back, humerus, and this is the lateral head and the long head. All done. And that's the audio clip which you have to speak. That's the audio part which you have to speak. You have to speak the boundaries of all these areas, right? And what are the structures which are passing through it? The structures which are passing through it, right? That is, this is just a description of that. Now the structures which are passing through it, important, from the quadrangular space, here it is, quadrangular space, it is the posterior circumflex humeral artery and the axillary nerve. Axillary nerve, remember it as a surgical neck. So that is part is done. Then from the radial part, radial nerve, right, along with profunda femoris, this will be that chota area, right? But it is near to the shaft. So obviously the shaft, it is over here. So it is the radial groove. So that will be passing through it. And this is where this upper one, right? That is where the circumflex scapular artery will be passing. This was for the brachial plexus. Par and 2Ms don't meet. Rest is all easy. And then we talked about the thymus, and from thymus we have got this first group, which is the anterior group, right? Anterior group, which is just underneath the pectoralis major. And then we have got the posterior group, which is on the edge, right? Anterior group will be supplying majority of the rest. Posterior group, that is for the axillary tail, which is along subscapular artery. And we have now the lateral, remember it is for the upper limb. Right? So in upper limb also there are nodes. Then comes this central one, central group. And that central group will be draining into the apical, which is just the infraclavicular node. Right? So that is how it will be draining all those. That's the order. Right? So that is done. Right? We took about 1 minute extra, 1.5 minutes. But yes, within 5 minutes. This is when you speak. If you don't speak and you just see, you'll be able to do it much faster. Right? But usually it won't take more than 5 minutes. And you try to go at that high pace. So after that, even when you close your eyes, you'll be able to revise it much faster. And do this thing before you go to sleep and do this thing as you wake up. Bas, फिर पूरे दिन ये चीज चलती रहेगी. And you'll be master of it. Audio clip, yes, I'll be waiting very eagerly for the audio clip. Right? Okay? Audio clip. Do send me. Let it fun. All right. So thank you so much. Love you all. And see you soon.
Sir,
हाँ बोलो.
sir, the
Plumbing line is also there. So what is important? Right?
okay, sir.
Because it happens like the nerve is more important, because when the supply is not there, so even if there is artery, it is that muscle is as good as dead. When the artery, right, when the artery is damaged, so usually there are so many collateral circulations which we don't even define, but in reality they do develop. So somehow blood, it reaches over there. But if the nerve is broken, then it is taklif. Right?
So, sir, the nerve is the majority.
Nerve is always important. Oh yes. All
Excuse
right.
me, sir.
हाँ बोलो.
You said the posterior circumflex artery goes from the posterior.
Correct.
So where does the anterior one go?
Anterior will go from the anterior side. There is no space, right? It is normal muscles. It will just wind around straight away the humerus. But posterior has to pass through that area.
Okay.
Excuse me, sir.
Uh-huh.
Sir, which software do you use for those 3D models?
This is a combination of many softwares, and they are some of them, they are pretty expensive. I would say don't buy, right? Say for surgery, for radiology, there are so many things. So it is like in the years I accumulated many of them, and so even someone asked a very good question: can we buy AI for studies? You can. Right? It is about 8,000-9,000 rupees a year, but it happens like, think it this way. A very good question, which was like, if say you are revising the PDF, gradually as the PDFs, they will start increasing as the load. Upper limb khatam hua, lower limb khatam hua, thorax hua. then it becomes like a gym. Gym में पैसे भरे जा नहीं सकते. You have purchased all these softwares, but you are not utilizing it. So that's why I never say that you spend money on any of these things. Get your good laptop, right? Which should work fine. It should not hang, right? Get that. For your comfort, if you say that, yes, I want to go for good headphones, surely go for it, right? Because that will give you good music, it will relax you. But any of the other tools at this point of time, don't spend, right? This is the Anatomy 3D architecture. That is the software which is used. For this training, you asked, this is called as the drawboard PDF, right? This is called as the drawboard PDF. Now, this thing costs another, say, 15,000-16,000 rupees a year. Right? You might say, chalo, main ye le leta hu, but when you'll end up, by the end of the year, you'll be spending 2-3 lakh rupees. So, nahi, abhi kuch bhi mat. There are free versions available. Use that in case if it is necessary. Abhi kuch bhi paid nahi lena. When you'll buy,
Yes, sir.
when you start earning, right? When it will feel like, yeah, theek hai, this much you can easily spend. So there is a difference between, say, it should be carrying its value and not the price. Not the price. If I'm spending, say, 16,000 rupees on drawboard PDF, so it is not the price, it is the value, because it is making you understand it better, right? Instead of showing PowerPoint to free hai, matlab aaya to even purchase PowerPoint also. But the thing is, why this extra? Because yes, it is adding that value. You are understanding it better. So usse badi baat aur kya ho sakti hai? So that is where 16,000 is kuch nahi. It is nothing. But otherwise, so I'll suggest you some of the free softwares. I just have to figure out. But there are PDF में आप लिख सकते हैं. There are so many free versions out there. So always initially तो बिल्कुल कंजूस रहना, बिंदास कंजूस.
Yes, sir. Thank you.
All right. So take care.
Thank you, sir.
Thank you, sir.
Thanks a lot.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Bye.
Thank you, sir.